Hello, and welcome to this moment of calm. Let's take a deep breath together, filling our lungs slowly and completely. And now, release it gently, letting any tension flow away. Today, we're going to explore something that seems simple, but is absolutely fundamental to healthy skin: the art of gentle cleansing. Cleansing is the foundation of every skincare routine. It's the first thing you do, the baseline from which everything else builds. And yet, it's also one of the most misunderstood steps. So many people approach cleansing with the belief that their skin needs to be scrubbed, stripped, and squeaky clean. But this couldn't be further from the truth. Your skin is not a dirty surface that needs aggressive cleaning. It's a living, breathing organ with its own delicate ecosystem. It has a protective barrier made up of lipids, natural oils, and beneficial bacteria. This barrier is your skin's first line of defense against the outside world. It keeps moisture in and irritants out. It regulates pH balance. It protects you from environmental stressors, and harsh cleansing destroys it. Think about how you feel after using a cleanser that leaves your face feeling tight, dry, almost squeaky. Many people believe this sensation means their skin is truly clean, but that tight, uncomfortable feeling is actually a sign of damage. It means you've stripped away your skin's protective barrier. You've removed not just dirt and oil, but also the beneficial lipids and moisture your skin needs to function properly. When you damage your skin barrier through harsh cleansing, you trigger a cascade of problems. Your skin becomes dehydrated, even if it's naturally oily. It becomes more sensitive and reactive. It may start producing excess oil to compensate for what you've stripped away, leading to a vicious cycle of over-cleansing and increased oiliness. Redness, irritation, breakouts, premature aging, all of these can be traced back to a compromised skin barrier, often caused by cleansing that's too harsh. So what does gentle cleansing look like? It begins with choosing the right cleanser for your skin. The cleanser you use matters enormously. Avoid anything with harsh sulfates like sodium lauryl sulfate, which create that satisfying foam but strip your skin aggressively. Avoid cleansers with high concentrations of alcohol, which dry and irritate. Avoid anything with artificial fragrances or unnecessary additives that can trigger sensitivity. Instead, look for cleansers described as gentle, mild, or hydrating. Cream cleansers, milk cleansers, and oil cleansers are often excellent choices. Even gentle foaming cleansers can work beautifully if they're formulated without harsh surfactants. The key is finding something that cleans effectively without leaving your skin feeling stripped or uncomfortable. When you've found your gentle cleanser, the next consideration is water temperature. This might seem like a small detail, but it matters more than you might think. Hot water feels soothing, especially after a long day, but it strips away your skin's natural oils and can cause redness and irritation. Cold water, while refreshing, doesn't cleanse as effectively because it doesn't help dissolve oils and impurities as well. Lukewarm water is perfect. It's comfortable, effective, and gentle. It's warm enough to help your cleanser work properly and to open your pores slightly for thorough cleansing, but not so hot that it damages your skin barrier. Before you begin cleansing, take a moment to test the water temperature. It should feel neutral against your skin, neither hot nor cold, just gently warm and soothing. Now let's talk about technique. How you cleanse is just as important as what you cleanse with. Start by wetting your face with lukewarm water. Cup your hands and splash the water gently over your skin several times. Don't rush this step. Let your skin become thoroughly damp before you apply cleanser. Take a small amount of cleanser. Often, a dime-sized amount is plenty. You don't need a lot. Rub it between your palms to warm it slightly, then apply it to your face using gentle circular motions. Use your fingertips, not your palms. Your fingertips give you more control and allow you to be more precise and gentle. Start at your forehead and work your way down. Move in soft circles covering every area of your face, your cheeks, your nose, around your mouth, your chin, your jawline. Don't forget the sides of your nose, where oil and debris tend to accumulate. Don't forget your hairline and the area around your ears. But remember, you're massaging, not scrubbing. There should be no friction, no pressure, no aggressive rubbing. Think of it as if you're touching something precious and delicate, because you are. Your skin is delicate. It deserves to be treated with care and respect. Imagine you're gently coaxing the impurities away, not forcefully scrubbing them off. The cleanser does the work, not your hands. Spend about 30 to 60 seconds cleansing. This is enough time to cover your entire face thoroughly without overdoing it. You might think that cleansing longer means cleaner skin, but it doesn't. Extended cleansing just irritates your skin unnecessarily. Be thorough, but be efficient. When you're ready to rinse, use the same lukewarm water. Cup your hands and splash water over your face repeatedly, making sure you remove every trace of cleanser. Residual cleanser left on your skin can cause irritation, clogged pores, and dryness. Keep rinsing until your skin feels completely clean and free of any slippery cleanser residue. This usually takes at least 10 to 15 splashes of water. Pay special attention to your hairline, around your nose, and along your jaw. These are areas where cleanser tends to linger. If you have facial hair, make sure you rinse thoroughly there as well. Take your time with this step. Proper rinsing is crucial. Once you've rinsed completely, pat your face dry with a clean, soft towel. Pat, don't rub. Rubbing creates friction, which can irritate your skin, especially when it's damp and more vulnerable. Press the towel gently against your skin to absorb the water. Your skin should feel soft, calm, and comfortable. Never tight, never irritated. Now let's address a common mistake: over-cleansing. Many people believe that cleansing multiple times a day will give them clearer, healthier skin. But the opposite is true. For most people, cleansing once a day in the evening is enough. In the morning, a simple splash of water or a very light cleanse is often all you need. Your skin hasn't accumulated much overnight, just some natural oils and perhaps a bit of sweat. Over-cleansing strips away your skin's protective barrier faster than it can rebuild itself. This leaves your skin vulnerable, dehydrated, and actually more prone to problems like acne and sensitivity. Your skin needs its natural oils. They're there for a reason. Gentle cleansing removes excess oil and impurities while preserving enough natural moisture to keep your barrier intact. What about cleansing devices and tools? Facial brushes, cleansing sponges, silicone pads. There are so many options on the market. Can these be part of gentle cleansing? The answer is nuanced. These tools can be helpful when used correctly and sparingly, but they can also be problematic if overused or used too aggressively. If you choose to use a cleansing tool, use it only once or twice a week, not daily. Use the gentlest setting if it's an electric device. Apply minimal pressure. Let the tool do the work, not your hand pushing it into your skin. And always make sure the tool is impeccably clean. A dirty cleansing tool can spread bacteria and for breakouts. Athletes often experience what's called acne mechanica, breakouts caused by friction from equipment, tight uniforms, and trapped sweat. Even your everyday clothing choices can contribute if fabrics don't breathe well or fit too tightly. Sweat itself doesn't cause acne, but it creates an environment where bacteria thrive. When sweat mixes with oils and dead skin cells on your skin's surface, it can clog pores, especially if you're wearing clothing that traps everything against your skin. This is why people often notice more body breakouts in summer or after intense workouts. The longer sweat sits on your skin, the more likely it is to contribute to breakouts. This is also why shower timing after exercise matters so much for preventing body acne. Hair products are a surprisingly common culprit for back and shoulder acne. Conditioners, hair masks, styling products, and even shampoo can run down your back during showering or transfer from your hair to your skin throughout the day. Many hair products contain oils, silicones, and other ingredients that are comedogenic, meaning they can clog pores. If your breakouts are concentrated on your upper back, shoulders, or along your hairline, hair products might be the primary cause. Occlusive skincare products can also contribute to body acne. Heavy body lotions, oils, and sunscreens can trap oil and bacteria in pores, particularly if they contain comedogenic ingredients. This doesn't mean you should skip moisturizer or sunscreen, but choosing non-comedogenic formulas designed for body use makes a real difference. Your body skin needs hydration and protection, just like your face, but the formulations should allow your skin to breathe. Hormonal fluctuations affect body acne just as they do facial acne. You might notice that breakouts on your chest, back, or other areas worsen before your menstrual period, during pregnancy, or during other times of hormonal change. Hormonal acne on the body tends to be deeper and more cystic, similar to hormonal facial acne. These breakouts can be painful and take longer to heal than surface-level pimples. Now let's discuss how to prevent and treat body acne effectively. The foundation of any body acne routine is proper cleansing, but technique matters enormously. Shower as soon as possible after working out or sweating heavily. The longer sweat sits on your skin, mixing with oils and bacteria, the more likely it is to cause breakouts. Even if you can't take a full shower immediately, changing out of sweaty clothes and wiping down with cleansing wipes helps reduce the time bacteria and oil sit against your skin. Choose your cleanser carefully. Look for body washes containing salicylic acid or benzoyl peroxide, the same ingredients effective for facial acne. Salicylic acid penetrates into pores to dissolve oil and dead skin cells, while benzoyl peroxide kills acne-causing bacteria. Start with lower concentrations, like 2% salicylic acid or 2.5 to 5% benzoyl peroxide, to see how your skin responds. You can increase strength if needed, but starting strong can cause unnecessary irritation. Apply your acne-fighting body wash to problem areas and let it sit on your skin for a minute or two before rinsing. This contact time allows the active ingredients to penetrate and work. Simply lathering and immediately rinsing doesn't give ingredients enough time to be effective. Use lukewarm water rather than very hot water, which can strip your skin and trigger more oil production. Hot showers might feel good, but they're not doing your body acne any favors. Your shower sequence matters more than you might think. If you're using hair products that might contribute to body acne, wash and condition your hair first, then cleanse your body last. This ensures that any residue from hair products is washed away rather than sitting on your skin. Clip your hair up or forward while washing your body to prevent it from dragging product residue across your back and shoulders. This simple adjustment can make a surprising difference for many people. Exfoliation is beneficial for body acne, but it must be done correctly. Body skin can handle more aggressive exfoliation than facial skin, but over-exfoliating still causes problems. Use a gentle body scrub or exfoliating gloves 2 to 3 times per week, not daily. Physical exfoliation helps remove dead skin cells that can clog pores, but being too rough or too frequent irritates skin and can worsen breakouts. Always be gentle, even though body skin is thicker than facial skin. Chemical exfoliants like alpha hydroxy acids can also be helpful for body acne. Products containing glycolic acid or lactic acid help dissolve dead skin cells and promote cell turnover without physical scrubbing. Look for body lotions or sprays with these ingredients, applying them to affected areas daily. They work well in combination with salicylic acid or benzoyl peroxide cleansers, giving you multiple approaches to preventing clogged pores. After cleansing, apply treatment products while your skin is still slightly damp. Benzoyl peroxide lotions or gels can be applied to breakout-prone areas. If you're using benzoyl peroxide, be aware that it can bleach fabrics, so wear old clothes or white clothing after application until it's fully absorbed. Salicylic acid body sprays are convenient for treating back acne since they allow you to reach areas you can't easily touch. These sprays typically dry quickly and don't feel greasy or heavy on your skin. Don't skip moisturizer on acne-prone body skin. Even oily or acne-prone skin needs hydration. Choose lightweight, oil-free body lotions labeled as non-comedogenic. Gel-based moisturizers work particularly well for body acne, providing hydration without heaviness. Ingredients like hyaluronic acid and niacinamide hydrate and help control oil production without clogging pores. Apply moisturizer to slightly damp skin to lock in hydration. Your clothing choices significantly impact body acne. Wear breathable, natural fabrics like cotton, especially for workout clothes and undergarments. Synthetic fabrics can trap heat and moisture against your skin, creating an environment where acne-causing bacteria thrive. If you must wear synthetic athletic wear, look for moisture-wicking fabrics designed to pull sweat away from your skin. Change out of sweaty clothes immediately after working out, even if you can't shower right away. Choose looser-fitting clothing when possible, especially in areas prone to breakouts. Tight clothes create friction and trap oil and bacteria against your skin. This doesn't mean everything needs to be oversized, but avoid clothing that's so tight it leaves marks on your skin or creates constant pressure. Pay attention to where your clothing creates friction, like waistbands, bra straps, and backpack straps, and consider how you might adjust or pad these areas. Wash workout clothes, towels, and bed linens frequently. Bacteria from sweat and oil can live in fabrics, reinfecting your skin every time you use them. Wash workout clothes after every use. Change your towels at least twice a week, and change your sheets weekly. When washing, use fragrance-free detergent and avoid fabric softeners, which can leave residue on fabrics that transfers to your skin and clogs pores. Be mindful of your backpack, purse, or bag straps. If you carry a backpack, the straps create constant friction on your shoulders and back. Consider carrying your bag differently, using padded straps, or placing a thin layer of fabric between the straps and your skin. If possible, switch to a crossbody bag or wheeled bag to reduce friction. Even small adjustments in how you carry things can reduce irritation that contributes to body acne. Sunscreen.
Con bé cũng xinh quá trời. Cái nét nó đẹp gái nè. Con chịu khó chút nha. Cố gắng chịu khó xíu ha. Cô lấy mụn cho nó hết mụn con nha. Nhà ba tự nặng hả? Mụn cứng quá rồi sao nặng được ta? Mụn nó cứng á. Cục bự bự không? Lát cô cho con coi mụn của con nha Tiền. Con gái có cái mặt Tiền mình lo mình chăm sóc. Ở nhà mình phải rửa mặt kỹ nè ha. Kỹ ngày 2 lần nè. Đó. Ăn uống mình giảm ăn mấy cái đồ chiên xào, mình ăn rau nhiều vô nè. Mình uống nhiều nước vô ha. Cái tuổi của mình nó đang dậy thì cho nên mình kỹ một tí. Chứ không là những cái mụn này á mình để thời gian lâu á, không biết làm sao không. Nó sẽ phát triển thành cái ổ viêm. Và khi mà viêm là nó sẽ bị cái sẹo rỗ. Cái sẹo rỗ rất là mất thẩm mỹ. Con biết sẹo rỗ không? Sẹo rỗ là cái mặt mình đang láng vậy đúng không? Thì nó sẽ có những cái vết lõm rất là xấu luôn. Xấu và nó sần sùi, nhìn nó ghê lắm. Cho nên bây giờ nó đang ở cái giai đoạn mụn này, thì mình chăm sóc nó kỹ một xíu. Qua bên cô trị hết mụn rồi về phải chăm sóc da ha. Làm sạch da nè. Bôi thuốc nè. Ăn uống đồ mát vô ha. Mụn của con cũng hơi cứng á, con chịu khó chút nha. Rồi nhẹ nhẹ qua đây cô. Ráng lên nha. Ở nhà con có tự lấy mụn không Tiền? Có không? Cố gắng xíu ha. Rồi ghi sát xuống đây cho cô. Thả lỏng ra. Có chỗ nào không thoải mái thì cứ nói cô nha.
Không đủ này là một cái thôi.
Các bạn ở trên lầu để chị làm cho nha. Luyến hả? Ừ. Chắc xíu con mấy cái chỗ này nó hơi sâu xíu, con cố gắng chút nha. Con cố gắng thì cô lấy cho con hết. Rồi xong được rồi nè. Giỏi quá. Xong.
and breathe deeply. Today we discuss preventing acne by keeping habits clean. Simple hygiene practices that significantly reduce breakouts through consistency and awareness. Clean habits are fundamental to acne prevention. While acne has multiple causes, hormones, genetics, stress, poor hygiene can worsen it, and excellent hygiene can help prevent it. These habits are simple, cost nothing, and make a real difference. Let's explore each clean habit that supports clear skin. First, face touching. Your hands touch countless surfaces throughout the day: doorknobs, keyboards, phones, money, accumulating oil, bacteria, and dirt. Every time you touch your face, you transfer these to your skin where they can clog pores and cause breakouts. Become conscious of how often you touch your face. Most people do it unconsciously dozens of times per day, resting your chin on your hand, rubbing your eyes, picking at blemishes. Set an intention to keep your hands away from your face unless you're cleansing or applying products with clean hands. If you must touch your face, wash your hands first with soap and water. This simple act prevents transferring bacteria and oil. Pillowcases require special attention. You press your face against your pillowcase for 6 to 8 hours nightly. Throughout the week, it accumulates oil from your skin and hair, dead skin cells, product residue, dust, and bacteria. Sleeping on a dirty pillowcase reintroduces all of this to your skin night after night. Change your pillowcase at least twice weekly. If you're very acne prone, change it every night or flip it to the clean side and change daily. This simple habit can dramatically reduce breakouts. Choose soft, breathable fabrics. Silk or satin pillowcases are ideal. They're gentle on skin, don't absorb as much oil as cotton, and cause less friction. If silk is too expensive, soft cotton works fine as long as you change it frequently. Keep several pillowcases on hand so you always have clean ones available. Make changing your pillowcase part of your routine. Towels also matter. Your face towel accumulates bacteria with each use. Using a damp, bacteria-laden towel on freshly cleansed skin reintroduces problems. Use a clean towel for your face every time you wash it. Dedicate one small towel for your face only and wash it daily, or use disposable paper towels for drying your face, or air dry your face naturally. If you share towels with family, have your own designated face towel and wash it frequently. Your phone deserves attention. Think about how often your phone touches your face during calls and how many surfaces it contacts throughout the day. It's a breeding ground for bacteria. Then you press it against your cheek, transferring all that bacteria to your skin. Clean your phone daily with a disinfecting wipe safe for electronics. Focus on the screen and edges that touch your face. Use speakerphone or earbuds when possible to avoid direct face contact. If you must hold your phone to your face, clean it first. Hair hygiene affects your skin, especially along your hairline and forehead. Hair products, oils, pomades, gels, dry shampoo can migrate onto your skin, clogging pores and causing breakouts. Dirty hair carries oil and bacteria that transfer to your face. Wash your hair regularly based on your hair type and oil production. If you have oily hair, daily washing might be appropriate. Change your pillowcase after washing your hair, as wet hair can leave additional residue. Keep hair products away from your face. Apply them carefully, avoiding hairline and forehead. Pull hair back from your face. especially while sleeping. If you have bangs, wash them frequently or pin them back while your skin heals. If you use dry shampoo, be especially careful. The powder can settle on your face and clog pores. Apply it away from your face and brush your hair thoroughly afterward. Makeup brushes and sponges harbor bacteria if not cleaned regularly. Each time you use a dirty tool, you're applying bacteria along with your makeup. Clean makeup brushes weekly with gentle soap or brush cleaner. Wash sponges after each use or use disposable sponges. Replace brushes and sponges regularly. Every 3 to 6 months for brushes. More frequently for sponges. Between washings, spot clean brushes with brush cleaning spray if used daily. Store brushes and sponges in a clean, dry place where they can air out. Sheets and bedding extend beyond just pillowcases. Your face may contact your sheets, especially if you move during sleep. Wash all bedding weekly in hot water to kill bacteria and remove accumulated oils and dead skin cells. Consider using fragrance-free, gentle detergent if you have sensitive skin. Harsh detergents or fabric softeners can irritate skin and cause breakouts. Hats, scarves, and anything worn on your head or face should be cleaned regularly, especially if worn during exercise or in warm weather when sweat accumulates. These items contact your skin and can trap oil, sweat, and bacteria against it. Exercise equipment that touches your face, helmets, headbands, protective gear, should be cleaned after each use. Wipe down with disinfectant or wash if possible. At the gym, wipe down equipment before use if your face might touch it. Bring your own clean towel rather than using gym towels of unknown cleanliness. Glasses and sunglasses rest on your nose and near your skin. The nose pads and frames accumulate oil and bacteria. Clean them daily with gentle soap and water or lens cleaner. Pay attention to nose pads and areas that touch your skin. Hands must be clean when applying skincare products. Always wash your hands thoroughly before your skincare routine. This prevents introducing bacteria and dirt to your products and face. Avoid dipping fingers repeatedly into product jars, which can contaminate products with bacteria. Use clean spatulas or pumps when possible. If you must use fingers, wash them first each time. Keep your bathroom and skincare area clean. Wipe down counters regularly. Store products in a clean, dry area. Don't leave product caps off where they can collect dust and bacteria. Dental hygiene affects your mouth and chin area. Bacteria from your mouth can cause breakouts around your lips and chin. Brush teeth twice daily and floss regularly. Change your toothbrush every 3 to 4 months. These clean habits work together synergistically. Each one individually helps. Combined, they create a foundation for clearer skin. Make these habits automatic through consistency. Set reminders if needed until these practices become second nature. Within weeks, they'll be ingrained habits requiring no conscious thought. These habits are especially important during active breakouts, but maintain them always for prevention. Clean habits prevent new acne while you treat existing breakouts. Remember that hygiene is just one piece of acne prevention. Proper skincare, stress management, adequate sleep, balanced diet, and sometimes medical treatment are also important. But clean habits are within your control and cost nothing. As we close, embrace clean habits as acts of self-care that support clear skin. Simple hygiene practices maintained consistently, prevent acne by reducing bacterial transfer and pore clogging debris. May you develop clean habits effortlessly. May these simple practices support clear skin. May hygiene become automatic and easy. Thank you for this time together. Prevent acne through clean habits consistently.
Effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Combining retinoids with other acne treatments provides advanced results. After retinoid tolerance is established, typically 8 to 12 weeks, carefully introducing benzoyl peroxide on different days, perhaps retinoid at night, benzoyl peroxide in the morning or on different evenings, can enhance overall acne control. However, this requires careful management. Combining retinoids with strong treatments too early in the process causes excessive irritation. Wait until you're using retinoids nightly without significant irritation before attempting combination with benzoyl peroxide. Combining salicylic acid with retinoids requires similar caution. Both are exfoliating and somewhat irritating, so combining them immediately is unwise. After 8 to 12 weeks of stable retinoid use with good tolerance, you might use salicylic acid cleanser in the morning and retinoid at night. The salicylic acid provides daytime exfoliation and sebum control, while retinoid provides nighttime cellular turnover and anti-inflammatory benefits. Oral antibiotics plus retinoids represent an advanced combination for moderate inflammatory acne. The antibiotic controls bacterial inflammation while the retinoid addresses cellular turnover and sebaceous gland normalization. This combination is particularly effective for acne resistant to topical treatments alone. However, careful introduction is necessary. If possible, allow 4 to 8 weeks of antibiotic therapy before introducing retinoids, then start retinoids at low frequency and concentration. Hormonal treatments combined with topical treatments represent a synergistic approach for hormonal acne in women. Oral contraceptives or spironolactone address the hormonal root cause, while topical treatments manage surface acne manifestations. This combination often provides superior results to either approach alone. For example, a woman might be on spironolactone plus doxycycline plus benzoyl peroxide, addressing hormone regulation, bacterial factors, and inflammation simultaneously. Chemical peels combined with home treatments provide enhanced results. Monthly superficial chemical peels combined with daily topical acne treatments provide more dramatic results than either approach alone. The chemical peel removes surface impurities and promotes cellular turnover, while daily treatments maintain and enhance the peeling results. Vitamin C plus niacinamide represents a complementary antioxidant combination that doesn't directly treat acne but provides skin-supportive benefits. Both are non-irritating and well tolerated together. Apply vitamin C in the morning for antioxidant protection, and niacinamide can be included in morning or evening moisturizers. These support overall skin health during active acne treatment. Important principles for combination therapy. Never introduce multiple new treatments simultaneously. If you want to combine treatments, introduce them sequentially. Establish tolerance to one treatment before adding another. For example, establish stable benzoyl peroxide use for 4 weeks before adding salicylic acid to your routine. Use complementary treatments on different parts of your routine when possible. For example, use salicylic acid cleanser in the morning, brief contact, mild treatment, and benzoyl peroxide leave-on at night, extended contact, potentially more irritating. This separation minimizes cumulative irritation. Monitor for excessive irritation. If combining treatments causes significant redness, dryness, peeling, or sensitivity beyond what either treatment alone causes, reduce frequency of one or both treatments. You can use both treatments but at lower frequencies. For example, benzoyl peroxide once daily instead of twice daily, or salicylic acid 2 to 3 times weekly instead of daily. The sandwich method reduces irritation when combining treatments. Apply your first treatment, perhaps benzoyl peroxide, wait 20 minutes, apply moisturizer, then apply your second treatment, perhaps retinoid. This dilutes treatment somewhat and reduces irritation while maintaining efficacy. Some combinations should be avoided or approached cautiously. Vitamin C and benzoyl peroxide together can reduce vitamin C effectiveness, so apply these at different times. Retinoids and strong chemical exfoliants used on the same evening can cause excessive irritation. Separate these if combining. Benzoyl peroxide with niacinamide is generally fine, though separating them, benzoyl peroxide at night, niacinamide in morning moisturizer, is easier. Assessment of combination therapy effectiveness requires patience. Most people need 8 to 12 weeks of consistent combination therapy to determine if it's working well. Acne doesn't improve overnight. Allow adequate time for evaluation. Adjusting combinations based on response is important. If one component seems essential while another isn't providing obvious benefit, you might discontinue the less beneficial component. Conversely, if you're experiencing insufficient improvement, you might increase one component's frequency or concentration, or add an additional treatment, perhaps adding retinoid to an existing benzoyl peroxide and salicylic acid combination. Professional guidance is valuable when considering combination therapy for severe acne. Your dermatologist can recommend appropriate combinations, warn about potential interactions, and guide introduction sequencing. Don't hesitate to discuss combination therapy approaches with your dermatologist. Guide 24, Understanding and Managing Fungal Acne, Malassezia folliculitis. Fungal acne, more accurately called Malassezia folliculitis or Pityrosporum folliculitis, is often misdiagnosed as bacterial acne. This condition presents similarly to acne but results from yeast overgrowth rather than bacterial infection, requiring different treatment approaches. Understanding this condition prevents prolonged ineffective treatment with standard acne medications. Malassezia is a naturally occurring yeast on human skin. In most people, it colonizes skin without causing problems. However, in some individuals, conditions favor Malassezia overgrowth, leading to follicle inflammation and fungal acne appearance. Unlike bacterial acne caused by Cutibacterium acnes, Fungal acne results from yeast proliferation. Fungal acne typically appears as uniform, small pustules, often in clusters on the back, chest, and shoulders, though facial fungal acne occurs. The pustules are often quite uniform in size and appearance, less variable than typical bacterial acne. Fungal acne is often very itchy or uncomfortable, more so than typical acne. It often appears or worsens after antibiotic courses, as antibiotic elimination of competing bacteria.
Welcome, and breathe gently. Dermaplaning is a professional exfoliation technique that's become popular for home use. Today we'll explore how to dermaplane safely at home, what benefits it offers, and when to avoid it. Dermaplaning uses a surgical scalpel to gently scrape dead skin cells and vellus hair, peach fuzz, from your face's surface. This creates instantly smoother, brighter skin, while allowing better product penetration. When performed correctly, dermaplaning is safe and effective. The key is understanding proper technique and using appropriate tools. Never use regular razors designed for body hair. These aren't precise enough and can cause micro tears. Instead, use single-blade dermaplaning tools with safety guards designed specifically for facial use. Benefits of dermaplaning include immediate smoothness and brightness, removal of peach fuzz that can trap dirt and oil, better product absorption as dead cells are removed, makeup application becoming smoother, and gentle exfoliation without chemicals. Before dermaplaning at home, ensure your skin is appropriate. Good candidates have normal to dry skin without active breakouts. Avoid dermaplaning if you have active acne, inflamed pimples, eczema, psoriasis, rosacea, very sensitive skin, or open wounds. Dermaplaning over active acne spreads bacteria and worsens inflammation. How to dermaplane at home safely. Start with thoroughly cleansed, dry skin. Never dermaplane on wet skin. You need to see what you're doing clearly. Hold your skin taut with your free hand. This creates a smooth surface for the blade to glide across. Hold the blade at a 45-degree angle to your skin. Use light, feathery strokes in short downward motions. Never press hard or use long strokes. Work in small sections: forehead, cheeks, chin, upper lip, jaw. Make 3 to 4 short strokes per area, always moving in the direction of hair growth. Don't go over the same area repeatedly. This increases irritation risk. Avoid dermaplaning over your eyelids, lips, or any blemishes. Use extreme caution around your nose, and don't dermaplane too close to your eyes. After dermaplaning, rinse with cool water. Apply gentle toners and follow with hydrating serum and moisturizer. Your skin will be more receptive to products, so use this opportunity for nourishing treatments. Always apply SPF. Newly exposed skin is more vulnerable to sun damage. How often should you dermaplane? Every 3 to 4 weeks is ideal. This allows sufficient time for cell turnover before the next session. More frequent dermaplaning can over-exfoliate and damage your barrier. Common concerns about dermaplaning include worries that hair will grow back thicker or darker. This is a myth. Vellus hair is fine and colorless. Removing it doesn't change the hair follicle structure. Hair grows back exactly as it was. Some worry dermaplaning causes premature aging or sagging. When done correctly with appropriate pressure and technique, dermaplaning doesn't damage skin structure. It's a surface treatment that doesn't affect deeper tissue. Potential side effects include minor redness immediately after treatment, which resolves within hours. Temporary sensitivity requiring gentle products for 24 to 48 hours, and if done incorrectly, nicks, cuts, or irritation. What not to do after dermaplaning. Don't use harsh actives like retinoids or strong acids for 48 hours. Don't exfoliate for at least a week. Don't use grainy scrubs or rough cloths. Don't expose skin to sun without SPF. Don't apply heavy makeup immediately. Give skin a few hours to calm. Blade maintenance matters for safety. Use a fresh, sterile blade for each session. Don't reuse blades. They become dull and harbor bacteria. Dispose of used blades safely in a sharps container. Professional dermaplaning by trained estheticians uses slightly different techniques and can be more thorough. If you're nervous about home dermaplaning, professional treatments ensure safety while you learn whether this exfoliation method suits your skin. As we close, remember that dermaplaning is optional but can be an effective physical exfoliation method for appropriate skin types. Done correctly, it's safe and provides immediate smoothing benefits. Take a breath. And if you try dermaplaning, approach it with patience and care. May your exfoliation be safe and effective. May your skin glow with health. May you find methods that work for your unique needs. Thank you for this time together. Be well and be gentle with yourself. Hello and welcome to this peaceful moment. Let's begin with a gentle breath together. Breathe in slowly, filling yourself with calm and ease. And breathe out softly, releasing any complexity or stress. Today we're going to explore how to keep your skincare routine truly soothing and simple, a practice that nurtures both your skin and your spirit. In a world that constantly tells you to do more, buy more, try more, there's profound wisdom in simplicity. A soothing, simple skincare routine isn't a compromise or a shortcut. It's actually a more enlightened approach than complicated multi-step routines that leave you feeling exhausted rather than cared for. When your routine is simple and soothing, you actually want to do it. It becomes self-care rather than a chore. Let's talk about what makes a routine truly soothing. Soothing isn't just about the products you use, though they matter. It's about the entire experience, the pace, the intention, the sensory elements, the emotional quality of the time you spend caring for your skin. A soothing routine calms your nervous system while it cares for your skin. It's a few minutes of peace in your day, not another rush task to check off your list. Simplicity means using only what your skin truly needs, nothing more. It means a routine you can maintain consistently without overwhelming yourself. It means products that work beautifully without requiring complicated layering or precise timing. Simplicity is the opposite of the beauty industry's message that you need 20 products and an hour-long routine. Simplicity is freedom. Let's start with the foundation, your mindset. Approach skincare as a ritual, not a chore. A ritual is performed with intention and presence. You're not just going through motions to get it done. You're taking a few minutes to be fully present with yourself, to care for your body, to transition between different parts of your day. This shift in mindset transforms the experience. Create the right environment for your routine. If possible, designate a specific space, your bathroom counter, a small vanity, wherever you do your skincare. Keep this space clean, uncluttered, and pleasant. Store only the products you're actually using, not every skincare item you've ever purchased. A clear space creates a clear mind. Consider the lighting. Harsh overhead lighting feels clinical and unflattering. If possible, use softer lighting, perhaps a small lamp or candles if you're doing your evening routine. Gentle lighting creates a spa-like atmosphere and helps you transition into a calmer state. Think about scent, but carefully. Some people find light, natural scents deeply soothing. Lavender, chamomile, rose. Others prefer completely unscented products. Honor your preference. If you enjoy gentle scents, choose products with natural, subtle fragrances rather than artificial, overwhelming ones. If scents trigger headaches or sensitivity, stick with fragrance-free formulas. The goal is whatever feels most soothing to you.